Did you know the term diabetes comes from an ancient Greek word meaning to pass through, referring to the frequent urination common in the disease? Meanwhile, mellitus means honey sweet because centuries ago, doctors noticed that the urine of people with diabetes tasted sweet. Thankfully, we've come a long way in diagnostics since then. Let's talk about diabetes, more than just sugar levels. Hey there, if you or someone you love is living with diabetes, or you're just curious about what it really means, you're in the right place. Diabetes is more than a condition, it's a lifelong journey that affects millions around the globe. But understanding it deeply can help reduce fear and empower better choices. What is diabetes? At its core, diabetes is a chronic health condition that affects how your body turns food into energy. Most of the food we eat is broken down into glucose, a form of sugar, and released into the bloodstream. When your blood sugar goes up, it signals the pancreas to release insulin, a hormone that helps glucose get into your body's cells. In people with diabetes, this process doesn't work properly. Either the body doesn't produce enough insulin, or it can't use insulin effectively. As a result, too much sugar stays in the bloodstream, which over time can lead to serious health problems. Types of diabetes explained beyond the basics. Type 1 diabetes, the autoimmune rebel. Type 1 diabetes is an autoimmune condition where the immune system mistakenly attacks the insulin-producing beta cells in the pancreas. It's commonly diagnosed in children, teens, and young adults, but it can occur at any age. Treatment: lifelong insulin therapy is necessary. People with type 1 must monitor their blood sugar levels daily and manage insulin doses closely. Type 2 diabetes, the lifestyle-linked challenger. In type 2 diabetes, the body becomes resistant to insulin or doesn't produce enough. Unlike type 1, this is often linked to lifestyle and genetics. It's more common in adults over 40, but younger people, even children, are increasingly diagnosed due to rising obesity rates. Treatment: management includes diet changes, exercise, oral medications, and sometimes insulin. Early diagnosis and intervention can reverse or significantly control it. Type 2 develops slowly, which makes it dangerous. People can live for years with pre-diabetes without knowing, until complications arise. Gestational diabetes, the temporary hitch in pregnancy. This occurs during pregnancy when hormonal changes cause insulin resistance. Usually diagnosed in the second or third trimester, it increases the risk of high birth weight, premature birth, and type 2 diabetes later in life, for both mother and child. Management includes dietary changes, exercise, and sometimes insulin. It usually goes away after birth but requires postpartum monitoring. Less common types, the overlooked few. LADA, latent autoimmune diabetes in adults. Sometimes called type 1.5, LADA starts in adulthood and is often misdiagnosed as type 2. It progresses slower but eventually requires insulin. MODY, maturity onset diabetes of the young, a rare genetic form of diabetes, usually appearing before the age of 25. Unlike type 1 or 2, MODY is inherited and doesn't always require insulin. Secondary diabetes, caused by other health conditions or medications, e.g., steroids, pancreatic diseases, or cystic fibrosis. Living well with diabetes, knowledge equals power. Managing diabetes goes far beyond taking medication. It's a holistic lifestyle shift, and it starts with nutrition matters. Choose low glycemic foods, whole grains, vegetables, lean protein. Control portions and avoid skipping meals. Limit sugary drinks, refined carbs, and processed snacks. Move your body. Exercise improves insulin sensitivity. Aim for 30 minutes of activity most days, walking, swimming, dancing, anything you enjoy. Monitor and medicate. Regular blood sugar checks help spot trends. Keep up with doctor visits and take medications as prescribed. Chronic stress can raise blood sugar levels. Prioritize rest and practice stress relief techniques like breathing, mindfulness, or journaling. Can diabetes be reversed? Type 1, not yet. Research into immunotherapy and stem cells is ongoing. Type 2, in many cases, yes. Through weight loss, diet, and exercise, some people can achieve remission, meaning blood sugar stays in a healthy range without medication. Whether you're newly diagnosed or supporting a loved one, know this: millions are walking this path with you, and with the right tools and mindset, a vibrant, healthy life is absolutely within reach. Let's change the narrative from fear to empowerment. Diabetes isn't the end. It's a new beginning in learning how to listen to your body, nourish it well, and take control of your health.